Welcome everyone to the first session of the Communities Prepared for Disaster Older Adults webinar series. This session will be offered in English with Spanish, Vietnamese, Russian, and Chinese translation, and with American Sign Language interpretation. To choose your preferred language interpretation, please click the globe icon at the bottom of your screen. You can then click on your preferred language. The ASL interpreters will be spotlighted on the main screen. Translated versions of the presentation slides will be provided in the chat. My name is Felicia Olmeta-Scholz. I'm a coastal hazard specialist with the Oregon Sea Grant and Oregon State University Extension Service, and I will be your host for today. And I have brown hair, brown eyes, and a pink sweater, and I'm also having my hair pulled back and a ponytail. This two-part series focuses on the unique challenges older adults experience in preparing for emergencies, such as living on a fixed income, having a limited support network, or having accessibility or functional needs. The older adult community is one that we all hope to be a part of one day and is greatly impacted by disasters in Oregon, such as wildfires, ice storms, and extreme heat. During the next 90 minutes, our partners will share their knowledge of preparedness and lessons learned through lived experience. In this session, we will go over medication guidance for disasters, scams to be aware of post-disaster, and how to navigate misinformation, and the importance of caring for mental health during disasters and ways to combat social isolation. Before we begin, let's go over some housekeeping items. To avoid disruptions and background noises, we have muted the microphones of participants. We have many attendees today, therefore, we can't have an open chat function. At the end of the event, we will have a facilitated question and answer session during which the presenters will answer your questions. You may put your questions in the Q&A box through the event. Please keep all questions and comments relevant to the topic being covered. There will be an evaluation sent out via email after the session. Your input is appreciated and will help us improve future sessions. While we are not expecting any problems during the presentation, should the presenter experience severe connectivity issues, we will do our best to re-engage or switch to the next agenda item. I'd like to introduce Phil Warnock, Executive Director for the Oregon Association of Area Agencies on Aging and Disabilities, to welcome you this morning. Go ahead, Phil.
Thank you. Good morning and welcome, everyone. My name is Phil Warnock, and I am the Executive Director of the Oregon Association of Area Agencies on Aging and Disabilities, otherwise known as O4AD. We are pleased to have so many people joining the webinar today. Purposefully planning and preparing our communities right now to account for older adults and people with disabilities during disasters is more important than ever, as we are an aging nation. According to the U.S. Census Bureau, for the first time in U.S. history, older adults are projected to outnumber children by 2034. That's just 9 years from now. Today's presenters will provide practical insight for your planning considerations that I'm sure you'll find extremely valuable. Thank you all for joining us today. We'll hand it back to our host for the introduction of our first presenter.
Thank you, Phil. We'll begin today's session with a panel of experts who will provide information regarding medication guidance during disasters. First, we have Heidi Murphy, Operations and Policy Analyst and Operations Manager of RARX with the Oregon Health Authority. Heidi joined state government in 1999. Before joining RARX in 2016, she worked 5 years for the Oregon Health Authority's prescription drug monitoring program as a research analyst and contract administrator. While there, she helped develop an electronic patient dashboard which flagged patients who met different criteria for overdose indications that healthcare providers could consult before prescribing. In her time away from work, she is a technician level ham radio operator, off-road enthusiast, and animal rescuer. Joining Heidi is Amy Servan, Senior Director of Pharmacy at Rogue Community Health. She graduated with a doctorate of pharmacy from the University of the Pacific and brings over 20 years of pharmacy experience. Transitioning into 340B services, Amy advocates for expanded healthcare access and improved public health for underserved communities. As chairperson for the Oregon Pharmacy Emergency Preparedness Committee, she works with state leaders to strengthen disaster readiness, and her personal experience with extreme conditions, from Alaska severe weather and power outage to hurricane aftermath in Alabama, has shaped her commitment to healthcare resilience and patient safety. Go ahead, Heidi.
Good morning, everyone. I'm Heidi Murphy, and as mentioned, I'm an operations and policy analyst on the pharmacy team at the Oregon Health Authority. Today I'm wearing a black shirt and I have brown hair. And as mentioned, I'm going to be talking about medication guidance for disasters. Next screen, please. Today I'm going to start with an understanding why it's important to know the environment that you live in and how that impacts how you prepare. Next, I'm going to describe a few key reasons to prepare, with some that you might not have thought of. We'll then delve into where you start with medication preparedness and how the ArrayRx prescription discount card may help you in those efforts. And then finally, we'll investigate your rights regarding medications and how to safely store your medications. Next slide, please. So I live in a town of 52 people, and it's got the least population density in the state. It takes a little over 3 hours to drive from one end of my county to the other. My backyard is the beautiful Owyhee Mountains. They're one of the most remote, wild, and untouched places in the entire country. But there's no services here. So we know that living here, we're largely on our own to solve problems as they arise. For medical emergencies, the quickest assistance from an ambulance is 45 minutes to an hour away. And this is also true of fire and police services as well. It's almost inherent to be self-sufficient living in a very rural setting like this, and we have prepared by being fully off-grid. You likely don't live in an environment quite like this, but there's plenty of reasons that you should keep preparedness, especially for the medications that you need, at the forefront of your thoughts and preparedness goals. Many of you live in urban environments. These can also present their own challenges with very different scenarios, including civil unrest. However, there are some issues that impact all environments. Incidents may either isolate you in your home or cause the need for you to leave with very little warning. For instance, flash flooding can cut off roadways or may require you to evacuate your home, like we recently saw in the city of Burns. Wildfires can impact people in any location. Earlier this year, we just saw the fires in Los Angeles impact a very urban environment. And not too far in the past, the 2020 Labor Day fires in Oregon caused a lot of destruction. Earthquakes are another potential threat. The Cascadia subduction zone stretches from northern Vancouver Island in Canada to northern California in the United States. This really highlights the need to have a go bag at your ready. In this, you can include your necessary medications, among other critical items, so you can just grab this bag really quickly and evacuate to safety. Be mindful of where you store this. It should be easily accessible enough to grab it really quickly in an emergency, but also safely tucked away enough that children can't access those medications stored in the bag. Next slide, please. There's other potential events that can happen, such as supply chain issues. The FDA maintains an up-to-date list of drugs that are in shortage. You can see that on the slide here. That website will give you supply chain news, reports, and publications, and you can check it regularly to determine if the availability of any of your medications are impacted. Health issues may also allow you not to travel to the pharmacy to pick up your meds. COVID provided us with a really great example of this. There may also be significant snow or storms that could impact travel. And then sometimes it may not even be a disaster. Your insurance could suddenly decide that they need a prior authorization for a medication that you've been taking for years. It sometimes can take weeks for the authorization from insurance. So it's also something to keep in mind and to plan for. So we can't prepare for everything, especially on a limited budget. It's best to consider what scenario is most likely to occur in the area that you live in and prepare for that. All the things that I've mentioned could impact your ability to obtain prescriptions. So starting with just this one thing, getting your prescription supply in order, can put you really well ahead of the game. To determine the risks associated with where you live, you can look to your county's hazard mitigation plan, and that'll rank hazards by risk. As you can see on the screen here, this shows my county. Wildfires are the highest risk, followed by severe weather. I live in the high desert, so not in an earthquake-prone area, so both avalanche and earthquake risks are prioritized low. Another option to learn more specifically about the environment you live in is to review Joel Skousen's book called Strategic Relocation. While you probably are not thinking about relocating, the book can be really helpful to you to understand the dangers posed by the area that you live in. The book is broken down by state, and then it further breaks it down into towns and cities within each state. And I know recently, in fact, that we had some questions from people wondering if they should actually relocate. So this book is an excellent resource to help you answer that question based on your situation. Next slide, please. There's been some questions surrounding strategies to maintain continuity of care when you're reliant on specialty medications. Our next presenter, Amy, is going to talk a lot in detail about specialty medications in her presentation. So I'm not going to go into a lot of detail on this, but I did reach out to the specialty pharmacy that we work closely with to better understand how they plan for potential large-scale disasters. And the good news is that we can rest assured that they've been planning for these things and have many protocols in place. They're able to quickly shift resources in a disaster to first fill patient needs in impacted regions, and they can reroute shipments to the patient's new location. They also have 24/7 on-call clinical support with clinicians available to address patients' medication and disease-related questions and needs. Additionally, at the state level, there's a memorandum of understanding in place, and this provides a framework for timely, effective pharmacy response to public health incidents like wildfires that we've mentioned, floods, severe weather, and other unexpected events. And then on an individual level, you can create an emergency medication plan. Keep an accessible record of essential medications, and this would include the drug name, strength, directions for use, and the prescriber. Identify the emergency contact information for your healthcare providers, pharmacies, and emergency transport services if those are needed. And then additionally, you can inform caregivers and family members about your medication needs and plans. If your medications require refrigeration, You can keep a portable cooler and ice packs available. If your budget allows, you may also consider a generator for a bit longer term needs. There's a few resources on this slide for urgent medication needs and durable medical equipment if you're either an Oregon Coordinated Care Organization member or an Oregon Health Plan fee-for-service member. To coordinate your replacement, use the email address that you see on the screen, which is dmap.rxquestions@oha.oregon.gov. Next slide, please. So now that you know some of the reasons to prepare with your medication supply and considering your environment, where do you start? As a person that's not a pharmacist but works on the pharmacy team, I'm able to give you some practical tips for disaster preparedness for your medications. I would suggest by starting the process by having a conversation with your doctor. If you currently only have a 30-day supply of medication, talk with your doctor about whether you should increase your supply to 3 months. Keep in mind that health insurance may not pay for this extra medication. One other way to slowly build a medication reserve is to refill your medications at the earliest possible date. Request a refill for your prescription as soon as your pharmacy allows. For instance, if you refill your non-controlled medication 7 days early every month, you will have accumulated an extra 6 weeks supply after 6 months and a 3-month supply after 1 year. Also keep in mind that while it's important to build this small reserve of your medication, avoid overstocking these medications because they could expire before you're able to use them. And always keep in mind, rotate your supply using the first in, first out method. Next, please. So this is where the ArrayRx prescription discount card could come in really handy for you. The discount card allows for up to 80% off of your medications. Any Oregon, Washington, Nevada, or Connecticut resident is eligible to enroll. There's no income or age requirements, and the card can be used nationally for any FDA-approved prescription. Next slide. So you enroll online at ArrayRxCard.com and receive a digital discount card. If you don't have an email address or internet access, you can call 1-800-913-4146 to enroll, and a card will be sent to you in the mail. You can use tools that are on the website to find participating pharmacies and to check the price of your medication with the discount card. You simply fill out your name, address, email address, and your date of birth, and then your phone number is optional. The digital discount card will then appear on your screen. You can save this to your Apple Wallet or download it to your phone. And you can also print out this card. Then you're ready to use it. Simply present it to your pharmacist and start realizing the savings. Next slide. And this slide just shows you what the actual discount cards would look like if you signed up for the program. Next slide. And next, I want to talk about a few rights that you have related to your medications. You have the right to information. As a patient, you have the right to easy to understand information about your prescription medications. You have the right to ask questions. Many people really hate to bother their healthcare professional with dumb questions. But if you really don't understand how or why to take your medicines, chances are you'll make a mistake. Your healthcare professional wants you to be well, so ask your questions. Answering questions is a really important part of their job. And finally, you have the right to take part in treatment decisions. Before you decide to take a medication, you should know its benefits, potential risks, and side effects, including what could happen if you don't take it. You should tell your healthcare provider how you prefer to take your medicine, for instance, in a tablet or liquids. Many times there's options that can be adjusted to your preferences. Speak up and work together with your healthcare providers so they know your preferences and concerns. Next, please. For most medications, the National Institutes of Health states that they retain at least 70 to 80% of their potency for 1 to 2 years after the expiration date if stored in reasonable conditions. However, the effectiveness of a drug can decrease over time. In a slide at the end of this presentation, I've captured the research articles for your review. This is a discussion to have with your healthcare professional to determine what might work best in your particular situation. Store your medication in a cool, dry place away from children and in a locked cabinet or safe. You generally want to store medications between 59 and 77 degrees Fahrenheit, so don't store them near heat sources like stoves. Don't store your medications in the freezer or in a hot car. And remember, some medications require refrigeration. It's better to store medications in a cool, dry place like a closet rather than the bathroom. Keep medications in their original containers. Most medications have child-resistant lids, which makes them hard for kids to open. We do understand that much of this is really specific to the individual, and the medication should be discussed with your healthcare provider. This is also an opportunity to manage expectations regarding how quickly resources can be brought in and that process to access them. Next slide. So a call to action is start today, get your medication supply in order. Have a conversation with your healthcare provider about increasing your day's supply of medication. And then sign up for the ArrayRx prescription discount card. It can help save you money on your prescriptions. Next slide. And this refers to several of the resources that I've talked about throughout my presentation. And next slide. And I really appreciate your time today. And at the end, we'll be happy to entertain any questions that you might have. Thanks.
Thank you, Heidi. And you can go ahead, Amy.
I'm having technical difficulties with my camera. I apologize. Good morning. Thank you. My name is Amy Servan. I am a pharmacist. I've been working in pharmacy since high school and then as a pharmacist for the past 20 years, and I'm excited to be here. I am a white female with short brown hair. I'm wearing glasses and a blue shirt today. Thank you. Next slide, please. My goal is for you to take away at least 1 or 2 actionable insights to help you feel more prepared for emergencies and disasters. Heidi had great information, and my goal is to add on to what she has provided uniquely from a pharmacist's perspective. We'll explore key strategies to help you ensure medication readiness during emergencies. Next slide, please. Having an emergency plan before disaster strikes is key, and I am a huge advocate for checklists. Stress is an inevitable consequence of emergencies and can worsen health issues, impair judgment, and lead to panic. A well-thought-out emergency plan can serve as a roadmap, reducing risk, stress-induced errors. In addition to having a plan, practicing your plan with caregivers provides control and reassurance. Next slide, please. It is important to consider who are your lifelines. Who is going to be close to help you evacuate if needed, manage your medications, and so forth. Consider your emergency contact list and who it should include. It needs to have all of your doctors to include your specialists. And for those of you that have to use multiple pharmacies, make sure you include all of your pharmacies. And then, of course, relatives, friends, and caregivers who may need to help you evacuate get you medications or supplies, and anybody else that needs to know you're safe during an emergency. Next slide, please. Here are the keys I feel are important to building a medication preparedness plan. This slide outlines some important elements and just a few things I will add. For creating your medication list, pharmacies often have wallet cards for tracking medications. Ask for one. And when stockpiling essential medications, it is important to remember to include essential supplies. Things like pen needles, syringes, alcohol pads, pill containers for organization, not for storage, and then coolers and ice packs for temperature-sensitive medications like insulin. When planning for refills, enroll in your pharmacy's medication synchronization or courtesy refill program to avoid gaps in filling and taking medications. These programs prompt the pharmacies to fill your medications when about 97% of your medication is expected to have been filled, so about 3 to 7 days before you run out. Be aware of refill policies. Third-party payers often limit refills, especially for controlled substances or high-cost meds, as do some companies and state regulations. And again, as mentioned before, if it's feasible for lower-cost medications, consider paying out of pocket to build up an emergency supply. Next slide, please. Rotate your emergency stock every 6 to 8 months. It is advisable to avoid storing medications over a year outside of the manufacturer original packaging. And then update your medication list regularly. Adjust for new prescriptions, discontinued medications, or dose changes. If you have a new prescription, make sure you add it to your kit. If you discontinued something, make sure you take it out. And lastly, increase any quantities if you've increased doses. And then keep your support network informed. New caregivers, doctors, pharmacies, or service animals should be documented. Next slide, please. Medication expiration safety varies, and generally pharmacists and providers can't confirm medication safety post-expiration without an FDA extension. But we can guide you in contacting manufacturers who often have completed longer studies on many of their medications. An exception to this is often specialty medications, also known as biologics, for a lot of the autoimmune diseases. Generally, tablets are more stable than creams or liquids. And critical meds not recommended for use after expiration generally include insulin, anticoagulants or blood thinners, nitroglycerin, liquid antibiotics, and eye drops. These medications typically lose potency quickly after their recommended use date. For example, insulin gradually loses effectiveness when it's taken out of the fridge, and especially when exposed to extreme temperatures. The longer it's exposed to extreme temperatures, the less control it will have over your blood glucose. In crisis situations, insulin stored above 86 degrees Fahrenheit may still be necessary, but extreme heat or cold will likely make it unusable. A couple of extra storage strategies. We've mentioned ice packs and coolers, but I also recommend keeping some frozen water bottles in your freezer at all times. They can be used to help with cold drug storage in emergencies, and as the water melts, you now have drinkable water. And if you're out of power and it's the middle of summer and it's very hot in your house, there have been some times where you could, if you have a waterproof container, use a toilet tank, not the toilet bowl, but the toilet tank to help maintain and store your cold drugs to help maintain those temperatures. Vacuum sealing pills may also help to extend shelf life slightly. Next slide, please. This is just a visual of talking about like how insulin will lose some of its potency and its recommended use beyond taking it out of the refrigerator and how long it's expected to still be effective. Next slide, please. Taking less than a prescribed dose does risk inadequate treatment and in some cases can worsen a health condition. Skipping or rationing doses can destabilize chronic conditions like diabetes and heart disease, and this can cascade into increasing complications for chronic conditions. Medications requiring consistent dosing, especially for mental health, can trigger withdrawal symptoms if the medication's rationed. I strongly encourage you to consult a healthcare provider for guidance. Your primary care provider or a pharmacist. Pharmacists can help identify alternative medications that may be available that have similar effects. They may be able to help you identify which medications may be safest if you must ration, and also advise you of what side effects could be the risk for having to ration medication. Next slide, please. So we're building our plan. Who do we talk to? Next slide, please. So pharmacists are the medication experts, and they can play a key role in medication stockpiling and emergency preparedness. We can help with identifying essential prescriptions, help to create a medication list with doses and frequency, and we can help keep vaccines updated. Most evacuees are put into disaster shelters, and there's a lot of people there, which increases infection risk, especially during things like flu season. And we can help with also knowing refill policies. Controlled substances and specialty medications have strict refill limits. Stockpiling may not be feasible, but your pharmacy can help navigate those early refills. And then proactively plan for your specialty medications. Specialty medications are, as I said, unlikely to be stockpiled. They're usually expensive and they have short expiration dates. It might be advisable to proactively plan to evacuate to other regions where access is likely more attainable. If you live in Klamath Falls and you have friends that you could stay with in Medford, maybe that's a better alternate than where a disaster shelter may be located. Know the name and contact information for your specialty pharmacy and have that information on you. And then again, pre-plan for evacuation sites if possible, and then have those addresses and your specialty pharmacy profile as a backup delivery location. If you know you're going to go to Medford and stay with your best friend during an emergency, make sure their address is listed as a backup delivery location. Next slide, please. What if you're mail order? Well, most medications can be transferred from mail order pharmacies to a local brick and mortar pharmacy if needed. Or the pharmacy can coordinate with your primary care provider or your specialist and get new prescriptions and refill them. They can then work with the insurance companies to get the overrides if they're early fills. Specialty drugs may be accessible through pharmacy partnerships, third-party payers, or in some cases, disaster area deliveries. We have some houseless patients that have worked with local brick and mortar pharmacies to have their medications always delivered to that pharmacy for them to pick it up. So I know this is feasible. Next slide, please. Here are some things that your physicians can help you with. I'd like to really state here that they can provide those emergency prescriptions and write specifically that an early refill is approved for whatever the situation is particularly for controlled substances. And they may be able to help secure additional durable medical equipment like backup batteries or oxygen tanks. Next slide, please. The insurance providers have been really good in disasters and emergencies at doing blanket overrides for early fills when patients have lost medications. However, it can take time for those overrides to kick in. Historically, I've seen it take 3 to 5 days. However, it takes a little bit more work for the pharmacy, but they should be able to call your insurance provider and get those emergency overrides for early refills as soon as there is an emergency that occurs. Many of the specialty pharmacies have care teams that may have had previous experience with emergency situations and may be able to give you more guidance. I believe that knowledge is power, so I really encourage you to reach out to your insurance provider for your medication coverage and your specialty pharmacies, and then ask how they have handled emergency and disaster medication deliveries historically. Next slide, please. For those that do not have insurance, there is the Emergency Prescription Assistance Program, or EPAP. This is a federally implemented program in disasters and emergencies. Pharmacies have to enroll, and nationally, there are over 72,000 pharmacies enrolled. When this program is activated, like it was for the Southern California fires, eligible individuals or uninsured individuals will call the 1-800 number and register, and then they can go to a pharmacy and receive a free 30-day supply of their prescribed medications. These can be renewed every 30 days at no cost for as long as EPAP remains effective. And then there are some other items, medical equipment and vaccinations, that are also covered under this program. Next slide, please. These are some agencies that support drug supply chain and pharmacies during emergencies. I just wanted to point out that in a disaster or in an emergency where there are a lot of pharmacies impacted, Healthcare Ready and National Council for Prescription Drug, or NCPDP, they have multiple resources for notifications of pharmacy closures, and then tools to direct patients and providers to open areas in those impacted areas, or open pharmacies in those impacted areas. And they offer pharmacies tools for uninsured and financially struggling patients impacted. Next slide, please. Just quickly, beyond medications, certain personal essentials should be included in emergency kits also. I think anything for support animals and pet supplies to include vaccination records like rabies tags, things like extra hearing aid batteries, canes, walkers, eyeglasses, dentures, and so forth, and then any important documents as well. Next slide, please. So my area was largely impacted by the Almeda fires a couple of years ago. And during the Almeda fire, displaced individuals were sheltered at our Jackson County Fairgrounds. Several local and state agencies were there to support the evacuees. It was amazing. And this included pharmacists. Pharmacists did routine check-ins to support evacuees. We were able to take their prescription bottles and their medication information, and where necessary, rewrite prescriptions and get those sent to local pharmacies for patients. And we offered on-site vaccinations for COVID and flu at the time. And then we also worked for collaboration to ensure medication deliveries to the shelters, or to help set up shuttles to take patients to local pharmacies to get their medications. We had two big challenges: cold drug storage. A lot of patients did not have a way to store their insulin, and it was really hot in September at the fairgrounds. We did partner with the Red Cross to help some of the storage. And then the other really big thing was durable medical equipment access. A lot of patients did not have their hearing aids, eyeglasses, dentures, or other things. And surprisingly, phone chargers was a huge barrier. A lot of people had all of their contact information, all of their medical information, all of their prescription information on their phones. And we did not have any phone chargers, or not enough, for people to be able to charge their phones to get to that information. So I would probably add that to my Go kit as well. Next slide, please. These are just some resources I put together for you. Again, I love checklists, and these sites have great checklists and tools to help you get started to be prepared. Next slide, please. And I know we'll have questions at the end. So to conclude, I hope you now have a couple more tools and ideas in your toolbox to be prepared. Thank you.
Thanks, Heidi and Amy. Our next speaker is Craig Vadiat, Consumer Education and Engagement Coordinator with the Oregon Division of Financial Regulation, the state regulator for the insurance and financial services industries. He works to promote the division's consumer protection and financial education resources so that Oregon consumers can access the division's consumer advocacy services and make more informed financial decisions. Go ahead, Craig.
Thank you, Felicia. Good morning, everyone. My name is Craig Vadiat, and again, I work for the Oregon Division of Financial Regulation, which is a state agency. And I'm a white male. I have short brown hair, a beard, I wear glasses, and today I have on a taupe-colored shirt and gray cardigan. I'm here to provide information to help you avoid disaster scams. Unfortunately, after a disaster, not everyone who rushes in is there to help. Scammers, including unlicensed contractors, government imposters, door-to-door scam artists will show up to take advantage of vulnerable disaster victims. And I hope that I can share what I share today can help you to protect yourself, and that what you learn you can pass on to neighbors, friends, and family so that we can prevent scammers from being successful. Next slide. I want to share a little bit about who I work for before getting into my topic today. I work again for the Oregon Division of Financial Regulation, and we are the state regulator for the insurance industry, as well as a wide range of financial services. And our mission is to protect Oregonians' access to fair insurance and financial services and products in 3 different ways. And that's through education, regulation, and consumer assistance. And I'm going to take a few moments to kind of describe how we put that mission into practice. Next slide, please. So as I mentioned, DFR, this is the Division of Financial Regulation, is the state regulator for the insurance industry and many financial services. We regulate companies that offer health, auto, home, and disability insurance policies. And we regulate industries such as the mortgage industry, student loan servicers, state chartered banks and credit unions, and you can see many more. On the regulatory side, we license the companies and individuals that want to do business in these areas, and we hold them to high expectations. We have an investigations team and an enforcement team to monitor any wrongdoing that might be taking place. And we also have a policy team which works to enact laws that helps to protect consumers, again, around the products and services that we regulate. Next slide. We also have a consumer advocacy team, and that's how we accomplish this part of our mission. So if you were ever to have a problem with an insurance company or, again, a financial services provider, you can call DFR's team of consumer advocates, and they can help to answer your questions, or if necessary, they can help you file a complaint. Again, if you're dealing with a problem working with any of the companies or individuals that we regulate. And they're available to reach Monday through Friday from 8 to 5, and they can also be reached at 888-877-4894. Again, dfr.oregon.gov. And just a quick note that the complaint process saves Oregonians money. Last year, we helped recover just under $9 million through our complaints process, and that's money that goes right back to Oregonians. Next slide, please. I also want to mention that I'm part of our education team, and that's also a part of our mission, and I'm happy to share with you today about our topic. Again, let's get to that. So to help us be more resilient when disaster strikes, can we go back just for a moment, please? Previous slide. Thanks. Just to help us be more resilient, I want to address some actions that you can take to be more financially prepared for disaster, and then also to cover information to help us better understand the recovery process. And that knowledge will be important to help us be less vulnerable to disaster scams. Next slide, please. So there are a few key steps to take to be more financially prepared to disaster. And I'm going to address most of these points over the next few slides. It's also important to keep in mind, I'm just going to mention briefly here, to avoid what is known as normalcy bias, which essentially means to underestimate potential threats. So we have an opportunity to prepare now, and we should take advantage of that opportunity to, again, take action to set us up to recover more fully. Another thing that we can do is to reduce risk. So thinking about steps you can take to make your home more resilient to disaster. What I'm going to address today are the additional bullets here. The first is to review your insurance coverage and make any necessary changes to make sure that you have the protection that you want. Another thing you can do is to create a home inventory, which is essentially a record of your possessions. We'll also talk a bit about putting together what we like to call a financial first aid kit. And then to, again, protect us during the claims process, I want to help you be more familiar with that process. And then, of course, we're going to touch on disaster scams and how to avoid them. Next slide, please. So one of the most important actions that we can take is to look at our insurance needs and then make sure that we have appropriate coverage types and limits, so coverage limits, to ensure we're protected. Unfortunately, many homeowners and renters are either uninsured or underinsured, which might expose us to significant risk. In fact, it's estimated that 60% of homeowners are underinsured by an average of 20%. And to put that into context, if you had a $500,000 loss to your home and the property within it, 20% being 20% underinsured would mean you'd be short $100,000 on your rebuild. And that's a significant amount of money. And how would we be able to come up with that money to make ourselves whole again? So if you have insurance, the declarations page of your policy is going to be on a single piece of paper, is going to explain the kinds of coverages, in other words, the kinds of protections that you have, the dollar limits of those coverages, as well as your deductibles. And that is a great place to start to make that determination. And we recommend you review your policies with your agent once a year, or anytime you have a change in your life that might affect your insurance needs. For example, if you remodel your home, or you have add an addition to your home. That conversation is an opportunity to identify coverage gaps and then look at options for filling those gaps. So use that information to make decisions and adjust your plan. Next slide. To be prepared in case of a loss, you can create a home inventory. And this is simply a record of your personal possessions. There's a number of ways to put together a home inventory. You can go to our webpage there, which is dfr.oregon.gov, and there is a QR code that can take you right to our Prepare Now page. The simplest way to create a home inventory is simply to walk through your home, taking video of everything in each room. So you could open drawers and cupboards, make sure you get into a shed or basements or your garage, and you might even narrate as you record to identify the objects that that are appearing in your video. So that's an easy way to create a home inventory. That might take you 30 minutes. You can also create a spreadsheet like Google Sheets or Excel and include descriptions of items, make and model numbers when that's appropriate, the purchase date, as well as the price that you may have paid. So that's another way that you can do that. There's also a variety of home inventory apps, and your insurance company might also have forms that they can provide for you to create a home inventory. Ideally, you would want to update this list every year. And then finally, it's important to consider, where do you want to keep your inventory? You want to keep it maybe with your emergency kit, or off-site, or potentially in secure cloud storage. Next slide, please. So you may have already created an emergency kit, but we should also have copies of important identifying and financial and legal documents. And we want to either store those securely again in cloud storage, or we could have those printed and either stored in with our emergency kit, again, at an off-site location, in a safe deposit box, or maybe with a friend or family member. And having this information can help us get the recovery process started more quickly. So what should we have copies of? Well, things like passports, driver's licenses, social security cards, again, legal documents like marriage and divorce papers, birth certificates, titles to vehicles, to your home, to farm equipment, as well as financial documents like your mortgage papers, tax documents, and even vet and pet records. In addition to that, you can create a list of your financial service providers as well as utility providers, account numbers, so your account numbers for those services, and the contact information to reach their customer service support. That way, if you've had to evacuate, you have that those phone numbers as well as your account information to be in contact with those service providers. Finally, make sure that you have set aside some emergency cash. Next slide, please. So if you do experience a disaster, it's important to understand the process involved to help you in your recovery. And DFR has a post-disaster claims guide. Again, you can find that at dfr.oregon.gov. And there's a QR code on the screen there to access it as well. So start by looking at your policy. If you had your financial documents in your go bag, your emergency kit, then you have a copy of your insurance policy that you can take a look at, including that declarations page. And if you don't have a copy, you can access that through your insurance company's website or app, or you can have them send you a copy. Before you file a claim, consider the costs and benefits, and you can talk to your agent or insurance company just about the impact of filing a claim. Keep in mind there's a difference between making an inquiry and filing a claim. If you make an inquiry, you can kind of just ask questions about what it might look like to file a claim. But filing a claim will go on a record for a number of years, even if the policy does not end up paying out for that claim, or it's a very small dollar amount that you receive. So consider that. You also want to think about the deductible when making that decision. So is the loss significant enough to file a claim? If you do decide to file a claim, then of course, contact your insurance company and they'll give you instructions and information to understand that process. As you talk to them, make sure that you're taking careful notes. You're also going to need to take reasonable steps to prevent further damage or theft. You do have a responsibility to mitigate damage, and that might look like putting a tarp on your roof or plywood up to cover broken windows, assuming it's safe to do so. And you should ask your agent or your claims adjuster what you're expected to do based on your situation. And remember to keep receipts if you do make those purchases. Be sure to take photos of the damage and then give your adjuster time to assess that damage. It's really important to not throw anything away and don't rush into repairs before getting those instructions. And then finally, keep receipts for, again, the mitigation work. So again, plywood or tarps, and for the cost of being displaced. So you might have to pay hotel bills, there might be restaurant bills, pet boarding, and with insurance, your additional living expenses portion of your policy should reimburse you for those expenses. So keep those receipts. Next slide. During that recovery portion, there's some general information to be aware of through that settlement process. And keep in mind that there are a number of factors that will affect the time frame. So one of them is the severity of the loss. Did you have a partial loss or a total loss? Of course, a total loss might take more time to rebuild and recover from. And then if there is a large-scale disaster event in your community, that might impact the availability of contractors, which can extend out the rebuild time and the settlement process as well. A few tips for the settlement process. Don't feel rushed or pressured to agree on a settlement. There are timeframes for all aspects of the claim, so keep that in mind, but also take time to make careful decisions. If you need to, ask for clarification. If something doesn't sound right, ask the adjuster to point out in your policy the basis for their decision. And they should answer your questions in a timely manner. If they don't, that's where you would want to call our consumer advocates. It's also important to stay organized and take good notes. You should be the consistent source of information. And the more information you have, in the case that you do need to file a complaint, that can help our advocates to work with you and have more leverage. And as much as you can, get communication in writing. If you have a phone conversation, you can ask the person you spoke to summarize what was discussed to confirm the information you covered in your phone call. Next slide. And I want to touch on two recovery-related topics that aren't commonly understood, but can have a significant impact on recovery. The first is about public adjusters and what to know about them. Well, there are three kinds of adjusters that you might work with following disaster. One is the company adjuster, and the company adjuster works only for the insurance company. The insurer hires and pays that adjuster to settle the claim based on your insurance policy and the damage that you suffered. So you don't pay for a company adjuster. An independent adjuster might work for several different insurance companies, and an insurance company might use an independent adjuster when it doesn't have enough of its own, when maybe faced with a large-scale disaster. An independent adjuster does the same work as a company adjuster, and again, you will not pay an independent adjuster. The insurance company pays for them. A public adjuster is different. This is a professional that you can hire to handle your insurance claim. And public adjusters have no ties to the insurance company. They estimate the damage to your property, they review your coverage, and they negotiate a settlement of the insurance claim for you. So if you do go with a public adjuster, you will pay them. Consumers often use a public adjuster when they feel the claims process is they're being shorted on that, or that their rights are being violated. However, DFR's advocates are available to address those concerns for free. So it's important to keep that in mind. Finally, here, public adjusters are paid through a percentage of a consumer settlement. And a lot of consumers don't realize that, and that can affect the amount of funds left for rebuild. So if you work with a public adjuster, make sure you're carefully reading the contract. Secondly, what do consumers need to know about signing over their policies to a third party, essentially a contractor, to settle the claims after disaster? This is known as an assignment of benefits. And it's an agreement after a loss where you transfer your rights of your policy and your claim to a third party, which is most often a contractor. Be cautious if you're asked to sign an assignment of benefits. You are not required to do so. You always have the right to file a claim directly with your insurance company. Now, an assignment of benefits can be a useful tool for getting repairs done. It allows the contractor to work directly with the insurance company. It also allows the insurer to pay the repair company directly. However, an assignment of benefits is a legal contract. So as a policyholder, you need to understand the rights that you're signing away and to make sure that the repair company is trustworthy. Once you've signed an assignment of benefits, your insurer only communicates with that third party, that contractor. And it's possible that the third party might demand a higher claim payment than the insurer is willing to offer, and then sue the insurer when it denies the claim. So a few important things to consider. All right, next slide, please. When you do work with a contractor to help you rebuild or repair your home, it's important to take precautions. One, be wary of unsolicited offers. Anyone that claims that they are a FEMA-approved contractor, or if they're a contractor coming from out of state. You can also avoid problems by getting recommendations of trusted contractors from friends and family. And then most importantly, confirm that the contractor is licensed, bonded, and insured, and check for complaints. And on our slide, you can see that you can do that by going to oregon.gov/CCB. Once you decide to work with or when you're shopping around for contractors, it's recommended that you get 3 written estimates that detail the work to be completed. Don't make assumptions about what will be completed. Make sure to get it in writing. Definitely read any contract before signing it. And then also, it's important to not pay in full until the work is satisfactorily completed. Also, don't pay in cash. It's recommended that you pay a deposit of no more than 1/3 of the total cost before starting the work. Next slide, please. So now we'll move into address some specific scams to be aware of and common red flags of most scams. Next slide, please. As I mentioned earlier, following a disaster, there's often a surge of fraudulent activity targeting both those who are seeking help or offering it. And scammers take advantage of the urgency, confusion, vulnerability, and desperation that people experience in the aftermath of those events. And they use various schemes to either collect money or personal information. And that environment leads people to make hasty or emotion-based decisions. So it's important for you to take time to gather and evaluate information, consider your options before making any decisions. And also, be in communication with family and trusted friends and community members as you navigate that difficult time. Next slide. So there are some common tactics used by most scammers, and these are going to be, again, similar from scam to scam. 1, be wary of any unsolicited contact or any contact that's out of the blue. That might include a knock on the door, a phone call, a text, an email, or a piece of mail. And be especially wary if anyone asks for personal or financial information. Your best bet is to simply not engage. If they're calling, hang up. If they give an email with a link, report it as spam. If you want to follow up, contact any organization that a person might say they're with by using their public contact information, right? That you can confirm by looking up maybe on the internet or that you're already familiar of. Second, be aware of imposters. They might claim to be representatives of a government agency, charities, utility companies, a nonprofit. So impersonating many different types of organizations. And you can verify by either checking a badge, which is not foolproof, but you should check a badge, and then again, check with trusted sources. So there's often pressure to act immediately to take advantage of a deal or to avoid a problem. And you should be able to take the time to sleep on a major decision. Scammers want to get you into an emotional state of mind. And if they can get you to think emotionally, you're more likely to make irrational decisions. Fourth, scammers often tell you to keep it a secret so that you won't have to respond to questions from curious friends or family. Instead, check with a friend or family member before making a decision. And asking for a second perspective is a quick and easy and effective way to help prevent fraud or getting caught up in a scam. Fifth, anytime a scammer insists on paying by a money order or by sending money, purchasing gift cards or depositing money into a Bitcoin ATM, that is a clear sign that a scam is being committed. They might also send you a fake check and then ask you to return a certain amount to them when the check that they send is fake and will ultimately bounce. The money that you send will be received by the scammer. So don't pay anyone that insists that you pay with a gift card, a money transfer, or cryptocurrency. It's a clear indication that you're dealing with a scammer. And finally, oftentimes we can spot a scam because it sounds too good to be true. Remember that if it sounds too good to be true, it probably is. And it's better to be cautious than be a victim. So this kind of funny phrase, to use your skeptical spectacles, to kind of be skeptical and listen to your gut before making decisions. Next slide, please. So moving on to a couple of common scams. The most common one is probably a contractor scam. And again, they might pose as a debris removal company or a mitigation company or a construction company. And they often will use high pressure sales tactics. They might claim that there is damage when there's not. And they typically will ask for money and then run, having either not done any of the work or having done poor or incomplete work. Another common scam are fake charity or fundraising scams. So beware of scammers seeking donations on behalf of victims. That might include fake GoFundMe pages. They also might imitate names of legitimate charities like the Red Cross or other charitable organizations. A resource that you can use is charitynavigator.org or charitywatch.org to help you vet charitable organizations. You'll also see government utility and insurance imposters, and they might show up in person, they might call or text, and they might be seeking money or personal information. Again, contact that organization directly using their official contact information. And keep in mind that government agencies and federal and local disaster workers will not ask for or accept payment no matter how they contact you. There also might be fake relief programs, or there might be scammers trying to access relief funds fraudulently. Scammers might try to charge a fee or collect personal information as you apply for a fake relief offer. Do not believe anyone who promises a disaster grant and then asks for an advance payment or a fee. Also keep in mind that fraudsters will apply for benefits using somebody else's name and address to get FEMA funds. Also keep an eye out for phony real estate and rental scams. They're often fake rental listings for folks that need to live in a temporary space because their home has been damaged. And a victim might pay a deposit, but then show up to find the home already occupied by somebody else. There's also price gouging that could take place, which is selling an essential consumer good or service at, and this is what the law states, an unconscionable excessive price, after the governor has declared a disruption of the market. And so a couple of things to keep in mind. An essential consumer good or service includes food, medical supplies and services, construction materials, water, fuel, and hotel rooms. And a price is unconscionably excessive if it's 15% or more higher than before the disruption. So there's going to be a comparison there. But there are some exceptions. Consider that contractors might have to pay higher prices because of increased inflation as they're buying from suppliers. There also might be additional costs due to a company having to pay overtime for employees that are working to address the demand for repairs. You can report suspected price gouging to the Attorney General's office, and that number is 503-378-8422. Next slide, please. Also, be on the lookout for misinformation and disinformation. To help us understand the difference, misinformation is where a person might not be intending to deceive, but ultimately does. And disinformation is when there is an intent to deceive. So it's really important to verify information from trusted sources, including government agencies, nonprofits, and news outlets. Please don't take a random Facebook post or a so-and-so heard as absolute truth. Check to verify. And most disasters will have an official Facebook page. So follow the sheriff's office or the county emergency office or the city on their social media or their website to get accurate information. Again, be very skeptical of unsolicited offers. Don't respond, hang up. If you receive an email, avoid clicking unknown links, which could have malware or ransomware software attached to them. And then be sure to attend community meetings. These are a great resource. They're hosted by disaster response officials, and they're going to connect you with legitimate recovery resources and factual information. Again, take your time to consider information and verify with family and friends, and then use what you've learned to educate others. Next slide, please. The Division of Financial Regulation, along with the Oregon Construction Contractors Board and the Oregon Department of Justice, has developed a disaster scams handbook. That's a great resource. And again, it is available at dfr.oregon.gov. You'll scroll down and you'll find our publications link, and it's available by the QR code. Next slide, please. If you do suspect scams or you're a victim of a scam or a bad business practice, it's important to report those attempts. Most importantly, report fraud to the FTC, the Federal Trade Commission, the Oregon Department of Justice, and FEMA. If you did pay a scammer, contact your bank, or if it was a wire transfer company or gift card vendor, and ask them to stop the charge or payment. And the quicker you act to stop transactions, the better. Again, any person that asks you to go to a Bitcoin ATM is a scammer. Report construction scams to the CCB. Again, that's oregon.gov/CCB. If you gave a scammer personal info, you can report that at identitytheft.gov, which is also run by the Federal Trade Commission. Make sure that you file a police report. And again, just a reminder that problems cannot be solved if people do not report them. Reporting helps to raise awareness of trends. It helps regulators to educate consumers going forward. And again, the quicker that you act, the more likely it is that you will benefit financially. Finally, keep in mind, if you're a victim of a scam, you are not to blame. You are a victim of a crime. Telling your story matters. And again, it ultimately helps to keep others safe and help you to financially benefit. Next slide. And that wraps up my part of the presentation. There is some contact information here on the slide. Again, our phone number is 888-877-4894. We have our email addresses, but also you can reach us at dfr.oregon.gov. And with that, I'll hand it back over to Felicia.
Thank you, Craig. Now we'll hear from Christy Darosa with Trauma Informed Oregon and Papiena Nomani, who goes by Ruby, with Living Islands. Christy is a licensed clinical social worker in the state of Washington and PhD candidate through Portland State School of Social Work with extensive experience in trauma-informed care and disaster resilience. Christy is currently employed at Trauma Informed Oregon, where they offer training and consultation in evaluating and implementing trauma-informed practices within organizations. Their work and research focus on supporting Black, Indigenous, and people of color community-based organizations in building community disaster resilience from a trauma-informed, culturally rooted lens. Living Islands is a cultural and education network organization supporting strong Micronesian communities everywhere by celebrating and advocating for the diverse and unique cultures of the Micronesian people. Ruby is married with 2 boys and 3 grandkids. She has worked for Living Islands as the liaison and volunteer coordinator for 5 years and loves every minute of it. She loves helping others, especially teaching others how to prepare for an emergency and how to be 2 weeks ready. You can go ahead with your presentation, Christy.
Awesome. Thank you, Felicia. Hi, everyone. Again, Christy, she, her pronouns from Trauma Informed Oregon. I am Asian American. I have brown eyes, black hair. I'm wearing a brownish tan shirt and a white jacket, and I have glasses. Thank you for joining us today. On to the next slide, please. So I'm a big fan of wilderness survival shows. I love seeing what equipment people bring, what skills they use to survive, and just trying to predict who will make it to the end of the shows. Yet over the years, I've come to realize something really important in these survival shows. And it's not the people who are most prepared on paper who win these challenges. The people who complete the challenge aren't necessarily the ones with the most skills or the best equipment. And instead, it's those with a strong sense of self-worth, purpose, co-regulation skills, and emotional regulation skills who succeed. These qualities help them stay out of that fight or flight or lizard brain mode and maintain connection to their prefrontal cortex, which is where our problem-solving part of our brain works, and allows them to be innovative and creative with the resources available to them, rather than focusing on what's missing. So, with that insight in mind, today we will be exploring the importance of mental health and community as a crucial component of older adult disaster preparedness and emergency management. Next slide, please. So when we talk about emergency preparedness and our go bags, we usually start, jumping into supplies like food, water, batteries. Do I have a flashlight? Where am I going to store my bag and things like that? And that makes a lot of sense, and that's really important. But one thing to note is most of our preparedness thinking is built on Maslow's hierarchy of needs, which tells us, as you see at the big bottom of the triangle on the left side, is that we must meet our basic physical needs first, and then address our emotional needs like belonging, trust, or purpose later. Now, for obvious reasons, meeting physiological and safety needs are important and should be prioritized. But I want to just offer a curiosity of what if this model was incomplete? Maslow's hierarchy of needs, this pyramid, was actually influenced by his time with the Blackfoot Nation. And in many Indigenous cultures, community is a structure that meets people's needs and is inclusive of mental well-being, mental preparation, just as much as our physiological needs. And again, thinking about how, when we're in an emergency disaster state, how we can be fully connected to all parts of our brains to be better able to prepare and problem solve and react to a disaster. Next slide, please. So within this framework, emergency preparedness isn't just about the individual, it's relational. That's what was really important to think about, because when we think about psychological first aid or the mental health sector, oftentimes we're diverting individuals to the mental health sector, which is usually one-on-one therapy. But this framework offers a relational perspective to this work. So that means it's about who we check on, who we cook for, who we co-regulate with, and especially who we trust and receive trust like important resources of information from. And so with this, preparedness must also include emotional connection and collective care. Preparedness in that way is also about legacy and continuity, passing wisdom, love, and care, not just applies to the future. Cindy Blackstock and other Indigenous scholars have suggested a shift in how we approach preparedness with this framework. So instead of individual responsibilities, what if we lean into community cohesion, where each person's well-being is nurtured through relationships? Next slide. Thank you. So as we prepare for emergencies, this framework offers not just the question, what do I need to survive, but also how do our communities help each other thrive before, during, and after a crisis? So depending on the situation, needs will shift in priority. One person might be like, hey, I'm going to take over the cooking. Another person might be looking out for the kids. Another tending to grief or holding conflict and conflict resolution. And in a community, many needs can be met simultaneously, and everyone has unique strengths and resources that they can contribute. So with that, let's talk about today's topic at hand, at least my topic at hand, which is social isolation, especially for older adults. Social isolation is more than just being alone. It means lacking meaningful social connections. And for older adults, this can lead to loneliness, depression, cognitive decline, and even physical health risks like heart disease or weakened immunity. And during emergencies, whether it's a wildfire, power outage, or a pandemic, this isolation intensifies. There are multiple barriers that we need to consider when we think about social isolation in an emergency. So mobility issues make it harder to evacuate or seek help. Communication breakdowns, whether from technology gaps or language or trusted sites, can make it difficult to understand what's going on. And for some, and arguably for quite a few, emergencies can also activate past traumatic distress, distrust, or fear, which can further deepen that disconnection and that sense of isolation. With that, it's important to recognize that social isolation is not just an emotional issue, but a public health risk. Research shows that approximately 25% of community-dwelling Americans aged 65 and older are socially isolated, and the health effects are comparable to smoking or obesity, with increased risk of premature mortality. So addressing social isolation from this perspective is just as vital as securing food, water, or shelter when preparing communities for an emergency. Next slide, please. We can do this through community connection investment. Research shows that when a disaster hits, people don't first turn to emergency management and our first responders, they turn to each other. So local relationships with families, neighbors, church groups, and our community-based organizations that offer the most support, can offer support immediately, have been offering that support prior to the disaster, and continue to offer that support in the long-term years after. These are the networks we need to protect, strengthen, and include in preparedness planning. We know that we regulate our nervous systems best when we're in relationship with others, and that's called the co-regulation piece, especially with people we trust. So as a little mental checklist, I invite you to consider the people in your life, not just like emergency phone call numbers on your list, but people in your life that you feel like you can rely on for that co-regulation piece. And with that, I invite you to also consider who is in close proximity to you when you might be in a disastrous place. So what's my relationship to my neighbor? What is my relationship to my library or my community center? What's my relationship to my grandchild who wants to call in? These relationships, as we invest in them, can be trusted connections that can lower anxiety and restore a sense of safety and collectively move us out of that fight or flight mode and get us into our problem-solving skills, long-term forward thinking, and meaningful action back to the forefront of our brains. Next slide. Okay, so studies reveal that older adults with higher levels of social support and community engagement are more likely to be prepared for emergencies. However, socially isolated older adults, particularly those in rural areas, are often the least prepared and the most vulnerable during disasters. So as we plan for emergencies with older adults, tackling social isolation through relational preparedness means weaving strong community bonds that support everyone. So to address social isolation among older adults in emergencies, this is just like some ideas based in research that we have found to be helpful in community connection. So one, promoting social connection as a public health message. Second, mobilizing family and community resources. So again, investing in the relationships around us before that disaster strikes, having those conversations with them as well. Third, developing technology-based solutions that are accessible to all parties involved. Fourth, engaging, as our first presenter said, engaging with our healthcare providers, including our veterinarians, and thinking about social isolation in the context of our animals and pets, and emergency planning that includes social connection. Fifth, using our aging social service networks to reach underserved older adults. And six, implementing distance connectivity strategies when physical proximity isn't possible. So again, thinking about our communities beyond our immediate community. So community-based organizations and intersectional partnerships can play a vital role in reaching older adults and providing support during crises. And their work can, in so many ways, reduce social isolation and enhance emergency preparedness. So with that, I would like to turn the attention over to Ruby, who is from an amazing community-based organization, and will share more about their work.
Thank you again, Christy, and I want to thank everyone for joining in. My name is Ruby Nomani, and I am with Living Island. I'm also a Pacific Islander woman with brown skin. I am wearing a Living Island t-shirts, and I have short hair and brown skin. I was asked to share about what we have with WEPI and also how we help a community and our older adult to prepare for emergency. As you can see on this first slide, it is what we call our WEPI. And WEPI stands for Women Emergency Preparedness for All Pacific Islander. Next slide. So in WEPI, I take 3 recap that we can share and talk about it today. The 3 important things that we, part of our WEPI recap. So the first one I want to share is the documentation prep. How to prep and safekeep crucial documentation in case of an emergency. We must create both physical and digital backups, storing it in an original or storing it in a safe envelope or water resistance or fire hazard. Otherwise, we can always keep the regular documentations and original in our safe deposit box at the bank. We also must include our identification, a copy of it, insurance policy, financial record, legal documentation, medical information, and also must have our family name and pictures of our family. We must include out-of-state family information, at least 2 of them, and also their phone number as well. The second one I want to touch is medication prep. And how do we prep for medication and remedies in case of an emergency? We must create a medication kit including all prescription medication that we take. We must include pain reliever, antacids, anti-diarrhea medication remedies. We must have at least 5 to 7 days of this medication over the counter. I also included, we must freeze a bottled water, one to three of those frozen bottled water in case of an emergency and no power in our home. With this frozen water, we can keep it in a cooler and we can keep our medication in it, which that require to be refrigerated, especially our insulin and everything. Not only that, but we can also use the bottled water to drink once the ice is melted. And the third one is also the meal prep or meal food to go. How and what meal do we need to prepare for in case of emergency? We must focus on non-perishable item like canned food. We must include canned meat like tuna, chicken, and any other kind of meat that you like and enjoy with your family. We must include canned fruit, can of vegetable. We can also use some canned soup. These are items that we need in case of emergency that we don't need to use a stove or anything if we don't have that in hand. We must include peanut butter. We must include cracker, water, nuts and trail mix, and any kind of dry meats with beef jerky, tuna turkey, or anything like that, including hard candy. Next slide. Oh, I'm sorry, go back to the last one, I'm sorry. And the third one that I want to touch on is, it was just on the food prep. Next slide, please, I'm sorry. Okay, on this one is the 5 keywords that I want to touch on. Is the first one is preparedness. In WEPI, we must equip participants, and we know the knowledge of nature, hazard of emergency preparedness by focusing on women, crucial role and managing household safety. So with preparedness, on this one, we did a 2 weeks emergency preparedness, and we as Islander communities, we use this for unique and needs of our traditional community. So preparedness, we use these pictures as preparedness. This is a tech that we did where we pass out to our community and our elder laptop, including iPad and Chromebook. We teach our older adult how to use it and how to access it. It's just like how we start to prepare. We get to prepare for our 2 weeks ready. We must start with a pack bag. And with this, we can always get ourselves ready and prepare for that. And secondly is social connection. The pictures that you see is a picture that we had for our hoop for our youth. And with this, we use it to bring our community together with youth and also with single adult. So with this one, we did our social focusing on bringing together everyone in closeness and sharing our relationship with one another. We include older adult in this one, where we share stories. And then we have guest speakers that we ask questions, and the kids has to ask questions on what they can do to prepare for their futures. And that's what we use for our social connection. We build trust with one another, starting with our youth all the way through to our older adult. With our co-creation, as you can see, is the third one. I use pictures of one of our guys doing fishing, and this is one of our event that we did. With our PI fishing, we teach everyone to prepare, how to prepare to be a fisher. With our community, we don't know how to prepare for fishing because we used to fish every day in our homeland, and we do it without license or anything. But this, we teach our community that there is a regulations that we need to follow. And in order to become a good fisherman, we have to follow those regulations, just like how we prepare for our emergency with our 2-week emergency. With our 2-week emergency, we teach our family and our older adult in our community through Webby on how to prepare for anything within case of emergency. And then on the third one, it says the meaning and making. Meaning and making, it is very important to us that we teach and listen and do what we have learned. And with this one here, we like to teach with correlations, community work together. As you can see, we have guitar. We learn to play guitar. In order to learn to play guitar, we have to have a guitar. We have to have one that has a string. We have to learn it. And by teaching that, we share our goal, understanding and desiring the outcome of it, mutual respect, relationship, and building trust for one another. Creativity and invocations, it's we learn from new ideas, from different perspective of whoever we brought together, we learn from them. And lastly is active participation. Everyone share their story, everyone share their knowledge and learn from their skill, but especially our storytelling. And the last one of our key topic is our elders leaders. Our elders leaders that I would like to share the storytelling of our leaders with our older adult. Back in June 15 of 2022, spoke with a gentleman about what happened with the eruptions and the tsunami that happened in the island. This old man was working in the farm. Out of nowhere, he noticed that every car was starting to have traffic. Everyone was running in the same direction as all the cars as they leave. But this man was working in the farm, was deaf. He didn't hear or anything that was announced that it was an emergency. But he noticed that all animal was running the different opposite directions. So in his head, he decided which way to follow, and he decided to follow all the animal. As he followed this animal as running to a higher locations, he followed them all the way there, and he was safe from the tsunami, and there was nothing happened to him, and he was grateful for his animal. The second storytelling that I want to share is from a typhoon Kiev that happened in 1992 in Saipan. A mother was sharing, her kids was making fun of her, how she was preparing all this emergency bag, like a go-to bag. They were making fun of her because she would rotate them every year to make sure that the food that she packed is not expired. She made sure that there was enough water. She made sure that every evening her car was full of gas. When the typhoon happened, all her kids and children saw what happened because for those couple of days, they didn't have any food, they didn't have any water or anything to partake of for the first couple of days of this typhoon. But with all this bag that she had packed for each of her kids, saved them from going hungry, thirsty, and all of that. And the last stories that I want to share, it's a Hurricane Inaki that happened in Kauai, Hawaii in 1992 of September. A father was sharing, when this happened, after the hurricane, everything was destroyed. There was no electricity, no store open, and there was no water to purchase. But with what her and his wife has completed, prepare for this, they have dig a hole around their yard and pour concrete on it, and they have stored every extra food that they have into under this underground. And when this happened, after the hurricane, they were able to be saved before the help got to them. They were saved by this food, the water, and everything that they have stored under the ground because of the prepare that they have done for the hurricane. The actions that I want to share with us today, with our elders as leaders, We can always listen to some of these elders through their storytelling and what they share. The action plan that I have is what we learn from being trained by our elders. Set a timeline, set resources and goal. And I would like to also end by inviting all of you to please come out and see for yourself in one of our events at Living Island. At Living Island, we try to bring our community together, share stories, and hear what they have to say or hear their stories and learn from it. At Living Island, I invite you all to please come and learn from it. We do meals at every event that we have because that's what brings our community together and build trust with one another. And I want to tell you guys, I really appreciate your time. And I hope from a few things that you will learn from what we do at Living Island. Next slide, please. This is our information of mine and Christy. If you ever need any additional information, please feel free to get in touch with us. Thank you very much.
Thank you so much, Christy and Ruby. And now for more information on how to build your personal preparedness, check out the Oregon Department of Emergency Management B2 Weeks Ready program at www.oregon.gov/B2weeksready. The information is available in English, Spanish, Vietnamese, Russian, Chinese, and with videos with American Sign Language, narration, and closed captions. A special thank you to all our presenters for sharing their wisdom and experience with us today. We hope the information offered today will help you and your organization become more prepared. At this time, we would like to give you the opportunity to ask questions. You can type your questions, recommendations, or comments using the Q&A function at the bottom of your screen. I now pass it over to Erin Zizet, Public Information Officer with the Oregon Department of Emergency Management.
Hello, my name is Erin Zizet. I'm going to leave my video off. I am just your voice for today, and I'm going to escalate questions that were not able to be asked or answered directly in the comments section. I am a middle-aged woman. I have blonde hair, blue eyes, and I am currently wearing a gray hoodie and glasses. I am going to start with questions. Were also a couple comments that I'm going to escalate and let our presenters answer, but I'm going to start with the questions. And I tried to divide them out by as they came up during certain presentations. Heidi Murphy, most of the questions I think came up during your presentation. So I'm going to start there. The first one is, how can those whose expensive specialty meds are only available in a 30-day supply adequately prepare for disaster?
That is a great question. I think you'd want to discuss with your pharmacist or your healthcare provider on that. And looks like Erin has a response to that as well.
I do not have a response to it. I was indicating on the question and answer platform that it was being answered live.
Oh, I'm sorry.
So that it clears out of the queue. Sorry.
So the next question, what does the ArrayRx card solve? Are elders not eligible for their Medicare scripts during the incident? Yes, they are eligible for their scripts during the incident. The ArrayRx card helps, particularly if you want to bolster your supply to pay for medications that your insurance might not. So you can cash pay with the card to increase your medication supply, and doing that at a great discount on that medication, up to 80%.
The next question was, how much authority does a pharmacist have to switch to generic or other available medication when resources of prescribed meds are limited? Anyone?
I can answer this one. This is Amy. For a pharmacist, we can legally switch to a generic at any time if one is available, unless the prescription is specifically written by the doctor to not switch it. It's actually pretty routine. As far as switching automatically if something's not available, during emergencies and disasters, the Oregon Board of Pharmacy has given pharmacists prescriptive authority, meaning that we can, in situations, write prescriptions and initiate therapy after consulting with a provider, any provider. But in general, if there's not an actual disaster enacted, we do have to work with the healthcare provider unless we're working under special authority with a clinic. But most pharmacists should be able to give recommendations to your provider of what is available and get those prescriptions usually changed pretty easily.
In a related question that came up during your presentation, Amy, someone brought up the comment that what needs to be addressed is the ability of the ability to maintain communication between patients, insurance companies, and pharmacies when phone and internet goes out. So during a disaster situation, how people can connect with all the people that they need to connect with if they are needing to get prescription medications. Which may not be something you have an answer to.
Yeah, that's a great question. It's something that we're working on and trying to have some preparedness, mobile units that can be, given out quickly to those areas to have, in essence, a mobile pharmacy or a mobile setup with, internet access through satellite and those types of things. And then just old school trying to, that's kind of the only answer we have right now. But if phone systems are completely wiped out, it does make things a little bit more challenging. That again is also where pharmacists' prescriptive rights and emergencies come through. If you have at least your bottles or an idea of your prescriptions, we can, and providers on site can initiate those prescriptions to get you at least an emergency supply until things come back online.
And one of the comments from Jane Wolf was that when they were taking costly specialty medications, they called the pharmacy about how to get a 30-day supply of meds post-earthquake. And the pharmacist said, I have no idea. They then called the drug manufacturer, spoke to several different departments. No one could answer their question. One representative said, don't worry, we'll send an emergency supply to you. The concern there was that they clearly didn't understand what the Pacific Northwest will face in a Cascadia subduction zone event.
Yeah, I don't disagree with that. I think with the disasters that have occurred in the past couple of years, we've had I think a little bit of a learning curve there. I think some of the specialty pharmacies are also learning, and drug supply chain as well. I think I go back to what I say, knowledge is power, and working through this and trying to figure out alternative sites if you do have to relocate to get them to send it to alternate locations may be the best for right now until better plans are in place.
Someone asked a question about, is it possible to get meds in containers that are easier to open in case they're injured or cannot open the childproof containers?
Absolutely. By law, we have to dispense medications in childproof containers unless somebody specifically requests that they not be. And then as soon as you've initiated that request, then it's documented usually in the pharmacy or wherever. And then from then on out, you should be able to get non-child resistant packaging for your medications.
I think that's it for Amy at the moment. I may come back to you in a minute. Can someone explain the acronym WEPPI again? Someone couldn't remember what that was.
The WEPI?
Yeah, the WEPPI acronym.
Yes, WEPI stands for Women Emergency Preparedness for Pacific Islander.
Let's see, someone asked about getting a copy of the presentation. This presentation will be up on our YouTube channel, along with links to the slide decks in the different languages. We will see if we can download a transcript of the chat. I can't make a promise about that, but we will try to do that. So that one is answered. Let's see. One of the questions that came up is, how do you increase individual preparation when many people don't prepare and assume community resources will come to help them during an emergency? Kayla, you want to take that one? I don't know if Kayla is muted or what's going on her end of things. I will say that this is an ongoing challenge, and one of the things that OEM works year round, what Kayla does year round, is get the word out, get people in communities prepared to be be 2 weeks ready prepared coordinators. The best way you can do that is to have conversations with your neighbors, with your community members, organize community events, connect with your community emergency response teams, and help them promote, and just really at the grassroots level, asking those questions, connecting Office of Emergency Management in your region, and see how you can support the work, the year-round work that your emergency manager is doing to try to get this outreach work done and get that message out as much as we possibly can. The reality is that some people are just not going to be able to prepare, or because they either don't have the financial resources, or they don't have the capacity for whatever reason to prepare. So getting community stockpiles as much as possible and working with those groups and really doing the community work. The benefit I always say too with this is, and this is something that was talked about with our last two presenters, is community preparedness work is community work. And we have an epidemic of loneliness in this country. And one of the ways we combat that is by connecting with the people around us. So getting to know your neighbors, having these conversations. You don't have to be an alarmist about it. Just making sure that they know what to do if there's an emergency, if the power goes out, if the heat goes out. We talk a lot about the Cascadia subduction zone. But most of the disasters that we deal with on the regular are heat waves, are wildfires, are bad air quality, are ice storms and power outages. Those are the things that happen seasonally, and they happen year round, and they affect our safety. And so checking on your neighbors and getting to know them. Next question. How does the current administration's cuts in FEMA and other agencies affect local, state, medical, and emergency services? What preparation is in progress to mitigate this, and/or response can we expect? This is a complicated question. At the moment, we don't actually know exactly how the cuts, or proposed cuts, I should say, will or won't affect funding in the area. A lot of this stuff is being challenged in courts. A lot of these things have not actually resulted in specific instructions by to states or state agencies. So we are continuing the work, and we will continue to do the work until we are told to stop doing the work. We always say that disasters begin and end at the local level, and that will always be the case. They begin and they end with your neighbors. They begin and they end with your community. They begin and they end at your city and your county levels. In the end, when a disaster strikes, the first responders are typically your neighbors. They're typically the people who live right next to you, followed by your local emergency response teams. That doesn't change regardless of what is going on at the federal level. So we keep getting 2 weeks ready, we keep getting 6 weeks ready, and we keep sharing resources with each other, and we keep connecting with each other. Let's see. Oh my goodness, more questions coming in. There's one here. We are a new profit assisting livestock owners with evacuation and sheltering of their animals during disasters. What methods or in what ways would you suggest would be most effective in communicating our services to older, underserved, and disabled communities, and most specifically individuals who do not have social networks? That's from Carla Hogan. Kayla, are you on? Carla, I am going to have Kayla connect with you because she has your registration information, and we can connect you with our response and recovery teams. Quinn Butler is our one of our response coordinators, and he does a lot of work doing what you're doing, trying to coordinate resources, especially in rural communities. So we can connect you that way. We have a question for our pharmacist from Leslie Shaw. What drugs are in the stored cache? Just standard ones?
Do you mean like the national stockpile of drugs?
I assume so. I assume that's what they're talking about.
Okay. I don't have a list of all of them. I can always get back. Typically, they're for things like antibiotics and antivirals, things that we would be concerned about in large epidemic and pandemics.
Hi,
Anthrax.
I'm so sorry. We have an issue with, we're hearing Spanish. Sorry, we're hearing some interpreters right now. There's some overlap with audio. Apologies. That does bring us to the end of our webinar, our scheduled time. So if there is a question that we did not get to, please feel free to email community.preparedness@oem.oregon.gov, and we will connect you with the appropriate person. Felicia, you can go ahead and close us out.
Thank you, Kayla. So thank you to all our presenters for giving their time today and the community partners who made this webinar possible. The Oregon Advocacy Commission's Office, AARP of Oregon, Oregon Sea Grant, Oregon State University Extension Service, and Oregon Association of Area Agencies on Aging. Thank you to the interpreters for providing language access for our participants. On behalf of the planning team, thank you for participating in today's session. You will receive a follow-up email with a feedback survey, resource links, and other supportive information. Take care.